Hello everyone, Namaskar. I am Dr. Sanjay Mishra, medicine consultant from Delhi. In this video, I would be talking about bleeding. Blood is the thing where if anyone sees blood, they start panicking, and panic doesn't help anyone. So usually people panic if they don't know what to do. And by panicking, the blood pressure rises and the blood flow increases. So that is why let us learn what to do so that we won't be panicking when we see blood. So what are the types of bleeding that we can see if we cut somewhere? So we have three types of bleeding vessels: arterial bleeding. If there is bleeding from the artery, there will be spurt, there will be flow, high flow. If there is venous bleeding, there will be low flow of blood. And if it is from capillary bleeding, it will just ooze. So what is the first aid and what we should keep in mind if we see blood coming out from some places? So a mnemonic of bleed we can remember when we see blood. So what does this bleed stand for? The first letter B stands for barrier. You see, if there is a cut among the family members, we won't be hesitating to do it with bare hands. But what if some stranger, some passerby, some colleagues whose infection status we don't know? So there are diseases which spreads when we touch blood of other people. So barrier is the first thing that we should think about. The other thing, the other L is we should locate it. If there is much blood, it gets spread very much, and the red color makes people anxious. So we have to locate the source of the blood. And once we locate the source of the blood, we can apply pressure. So we can apply pressure with hands if it is your own. We can apply pressure with the cloth on it. And if the pressure doesn't stop the bleeding, then we have to apply tourniquet. I hope some of you or many of you would be knowing what is a tourniquet. So a tourniquet, where to apply? So these are the locations given in the picture. Usually it should be applied where there is one bone, so that when we apply a tourniquet, all the downgoing vessels are contracted. So the good place to apply tourniquet is in the arm. Usually it should be above the cut place, and in the leg it should be in the thigh. So if there is any doubt, we should apply the tourniquet above the cut location. Now, what do we need for a tourniquet to make a good application of tourniquet? We can just have a long cloth, a tie, a handkerchief, a long one, and just a stick or pen or pencil, and that will be enough for making a tourniquet. If there is a belt, that's a very good thing that can be used for as a tourniquet. So when we have a piece of cloth which is long enough, we will wrap the cloth around the arm or around the thigh, and we will tie a knot, and we will place a stick on the knot, and we will tie a second knot, and we will rotate the stick. By rotating the stick, the grasp, the knot will become tighter and tighter, and the bleeding will ultimately stop. So the point where the bleeding stops, that stick which we are making tight should be secured and tie another knot so that it doesn't rebound, it doesn't get loose. In some cases, we can find that even after applying this tourniquet, the bleeding is still spurting. What we can do is we can apply an extra bandage roll or extra piece of cloth, uh, place it on the arm and tie the knot again above that piece of cloth. So that will strengthen the tourniquet further. If it is a leg, it should be on the thigh, because we have thigh and arm bone, only one bone, and if we tie it around strong tourniquet, the chances is there that it will know, the bleed will stop. There are places where we cannot tie it very tight, like on the head. So what we can do is we can place this extra piece of bandage or extra piece of cloth and just tie it so that the bleeding stops. The pressure is applied on the site of the cut. Well, there may be cases of nosebleed. So what to do here? The process of applying pressure, the process of applying tourniquet, it doesn't apply here. So what can be done in nosebleed? That the victim or the child can just sit on the chair. If it is a small baby, the baby can be taken in the lap, and we have to pinch the soft part. We have two parts of the nose. The one above is the bony part and the one below is the soft part. So we have to pinch the soft part of the nose. Pinching the bony part won't help it. So we have to pinch the soft part of the nose, and the head should be tilted forward. Don't make the patient or person lie down. Don't blow the nose, because as a reflex, what people do is they blow the nose and try to cough out or sneeze out the blood in the nose. And also we can put a ice pack on the bleeding nose. So these are the location wise pressure tactic that we can put an external pressure on the cut side. So nose, just like I said, it should be pinched on the softer part of the nose, and it should be pinched for 5 minutes uninterrupted. This is very important, because if we keep on releasing the pressure and seeing it after every minute what is happening, the effect won't be there. And the nozzle in the nose, there it is basically capillaries. So nothing big vessel is there in the nose. Nothing to worry. Just pinching it for 5 minutes, 5 to 7 minutes will solve it, will stop the bleeding. So this 5 minutes of pinch, continuous uninterrupted pinch, is very important. And we can apply ice on the nose. The ice cube can be wrapped in a cloth, or it can be wrapped in paper. The first E stands for external pressure, what we have seen. The second E stands for the elevate, how to elevate the injured part of the body. So to stop the bleeding, we have to elevate the part which is being hurt, which is being cut, above the level of the hurt. So if the patient is lying down, a little elevation will do. If the patient is sitting, it has to be elevated much, so that the injured part or the bleeding part is at the level higher than the hurt. So then with the gravity, the bleeding will stop. What is the D stands for? D is for dressing. So after pinching it, after keeping pressure for a few minutes, the bleeding will stop. But if we leave it like this, there will be rebleed again. So what we have to do is we have to apply a pressure bandage. We can put a gauze piece or piece of cloth on the bleeding side, and then we can tie it tightly. And this can be tied for a day or at least for 8 hours, so that the bleeding doesn't recur. And this is enough for venous bleeding, for capillary bleeding, for arterial bleeding from medium and small arteries. And the tourniquet is required only for bleeding from major arteries, which has a very big diameter. So this would be the first aid that you need to know when you see blood coming out from any side. And hope this knowledge will make you not panic and act accordingly, and keep you calm, because you know what to do when you see a bleeding spot, or when someone hurts and gets a bleeding episode. So thank you very much for watching this video. Namaskar.